So we all wonder about nursing homes or rehab centers or buildings that have, even people who claim that they're going to, they're exercise centers. We don't really know what goes on inside. But you have to go in and you have to try, you have to get a tour, you have to call about those people, get on the website, and check them out. And the best way to do that, of course, especially here in Boca Raton, is to listen to radio shows like we do here. And Leslie Curtis has been on our radio show for, has been 10 years. It's been a long time. Yeah, been a long time, Leslie. And it shows so much how you care, what you know. And I don't know if we ever mentioned really that you do have a nursing, background. That's really what you have loved. And then you wound up in a position which is interesting. It's the Director of Business Development, and that's because you know so much about all that happens within Regents Park.
It's the kind of position that you kind of grow into, I think, because I started with nursing and then ended up, believe it or not, working for an insurance company doing case management. And then I moved to working in acute rehab.
That's not acute rehab.
No.
It's acute.
It's acute. It's a hospital rehab. And then I left there and went into the skilled nursing arena. So, yeah, you kind of grow into it. And as healthcare changes, you have to be there to understand what the changes are, so you can best implement programs that are appropriate for your community.
And they have changed, haven't they, from when you first started? What were they like years ago?
God, years and years ago, if just in a regular hospital, if a male was admitted for whatever reason, and he was the caretaker for the wife, she would be admitted too under some trumped-up thing. And the length of stay was incredible. Yeah. That happened all the time. That's why you see Medicare cutting back and making the rules that they make now. You have to meet a certain specific criteria. And then really, they kept people in the hospital. Very few people went to, quote, nursing centers for rehab because they got it in the hospital. Well, as Medicare started to crack down and they want those people out, and they've now do what they call DRGs. They get paid, the hospital gets paid X amount of bucks per diagnosis. So they want you out because they're going to make the same amount of money no matter how long you stay. So then the skilled nursing facilities were the places that people would come for short-term rehab. The acute rehab hospitals, their rules got much more stringent. So people that they used to take, they can't take anymore. So,
for example, what would that be?
Oh, they used to take anybody. They did because Medicare said there was a 10-day evaluation period. So they took a lot of people that probably weren't appropriate at the time. They come to us now. So really, those facilities, you have to have specific diagnoses, spinal cord head injury, trauma, and if maybe bilateral knee replacements at the same time with medical, past medical situations that they're dealing with. But a lot of those patients, they can no longer take.
And thinking about what you've been saying, all of it is kind of, what's the word? It's not pleasant.
No.
To be in the hospital is not pleasant. Then to go to some of the facilities, and I remember them. I used to, when I was just getting my gerontology degree, I had to go in there and I had to do all sorts of research and on. I couldn't wait to go home.
Right.
Because it was, it just isn't pleasant. And even though nurses were good, patients, it wasn't the patient, it's just the whole environment. And so now we can fast forward to 2010, whatever it is. And thinking about Regents Park of Boca Raton, it's so different. It's like night and day from what occurred before.
Oh, absolutely. I remember one of the first nursing jobs. I went to a nursing home and toured, and I couldn't wait to get out. It's like, no way. You know, it was horrible. You know, the smell hits you when you walk through the door. Very few facilities are like that now. I mean, there's a couple, but you know, there are ways to take care of patients where that should just not happen. And for Regents Park, you know, we had added probably about 10 years ago a wing simply for short-term rehab patients. And the rooms are very nice with the flat screen TVs and on and on. But then we have the long-term side that we are now remodeling, all of them. I don't know how long this is going to take. It's a real project. So they're putting down nice floors, flat screen TVs. They're painting all the walls, just like the short-term rehab unit. We started that, I think, about maybe a month and a half ago. So we're shutting down X amount of beds, and we have to move the patients out of the rooms, demolish. It's a real project.
Well, but it seemed like they looked pretty good to me when I was there last. I'm surprised that you're doing this.
Yeah, I mean the rooms are nice. They had regular linoleum on the floors.
So what are you going to put now?
The wood.
Yes, the parquet floor.
Yeah, I mean they're really going to be nice. They're redoing the bath. They're redoing the whole rooms.
Yes, people just expect this in the kind of quality that you have it. Maybe
Right.
they don't expect it in a lot of places, but you really are top of the line. And so when they go there, they have their friends, their family comes in, and they're going to stay there. It's like they may have been living in a gorgeous condominium, and now they can't any longer.
Right.
Well, they don't want to live in anything less than that.
Right. So, you know, I mean, the remodel is due. But, you know, the way we look at it is, yeah, this is their home. You know, it should look nice. It should be as nice as what the short-term residents have. So
And can they bring in things of, let's say they're going to stay there, live there.
Uh-huh.
Can they bring in their own certain things?
Yeah, absolutely. I mean, once they decide that that's their home, they can bring in pretty much whatever they want, so long as it fits safely, you know, in the room. But, yeah, they hang their own pictures and, you know, very few people bring in their own bed. And we have the built-in dressers and wardrobes, but they can bring in.
Oh, pictures and certain kinds of
Yeah.
draperies or things that they love that,
Right.
you know, they say. So actually at Regents Park of Boca Raton, you do have short-term rehab.
Right.
Is there such a thing as long-term rehab?
There's not long-term rehab, but what happens is, I think it's quarterly that rehab will evaluate to make sure that they haven't had a functional decline. If they have, then they'll pick them up and give them some rehab to bring them back to their prior level of function. If a long-term resident goes to the hospital, when they come back, rehab will evaluate them, and if they've had a functional decline, which most people do in the hospital, then they'll pick them up under Medicare Part B and treat them till we get them back to their prior level of function. Plus, we have restorative nursing.
What's that?
Well, when rehab is done, you know, they'll let our restorative nursing team know what to continue to do with the resident, whether it's to walk them twice a day, it might be range of motion, you know, just those kinds of things to help them keep their independence or as much of their independence as possible.
So, Leslie, when someone comes in, they're evaluated as to where they should be, and you have your team. I know you've always been proud of that,
Yeah.
you know, all the team and the social workers and the therapists. But then some people, I guess, they need to be there on a full-time basis, you know, but yet they may not want to. And
Right.
So what happens?
Well, I mean, if a patient comes in for short-term rehab and they don't do as well as everyone hopes they will, then if they can't go home, you may be looking at someone that needs to go into an assisted living situation or stay long-term care at somewhere like Regents, which would be if they're, you know, maximum assist with, you know, feeding, grooming, dressing, bathing. If they have a feeding tube, they don't meet criteria for other facilities, then they need to stay at Regents. Usually, some of them are aware of the fact that they can't live independently anymore. Some of them cognitively are not intact, so they might be angry, but they forget, why they're angry. The ones that are totally, intact are the ones that probably are the toughest for that transition.
Well, I'm going to get back to and ask you some questions about what the alternatives are for the, not so much for the patient, but for the family, because they're the ones that are suffering over this. They don't know anything that's going on, and I want to do that. But first I want to give some information. Leslie is a wonderful woman to talk with. You can hear her on the radio that she's believes in this so much. And you could call her, ask for her specifically at 561-483-9282. That's 483-9282. They're located in a very convenient area, right in Boca Raton, right near the mall, but also hidden away in a very lovely residential area. If you want to go on the web, and they have a fantastic website, it has YouTube pictures on it. It's just wonderful because they have, but Laura Belgrave, I just have to mention, she does so much of their social media and so many things. She takes pictures, so I think you're really going to enjoy their website. I know you get a lot of response on your website. Yeah, that's probably because it's so beautiful. It's regentsparkboca.com, regentsparkboca.com. So this is what I want to ask you, because it's really the family members. Mm-hmm. See, I have a problem with the family members who absolutely think they know what they're talking about. They don't live here. They don't understand anything that's going on. And they come in and they're going to tell you everything that you should do with their mother or father. How do you work on that, Leslie?
It's tricky. Every family is different. I think, you kind of look at what the relationship was with the patient and family prior to their admission to the hospital. Sometimes you're dealing with feelings of guilt, in which case you have to try to work through those with them. Guilt, anger, because they don't want to be in that predicament and they don't know what to do. So it's really just meeting with them frequently, sometimes because they're requesting it, or sometimes just to help them get through the process. It's very difficult, especially with out-of-state kids. You have no idea how many of them say, Mom was fine, she was living alone, everything was fine. No, she wasn't. If you go into her apartment, you can tell she wasn't. Because a short conversation, the elderly can sound fine. But, they can fabulate. They make things up. What did you have for breakfast? Oh, I had eggs and this and
they
that.
They make it up, huh?
And in reality, they had nothing. But they can fill in the blanks very well. So, the family does think that they've been fine. But they haven't been. And usually when they get to their condo or apartment, then they can see things were not okay. So it's a lot of reasons and ways that you deal with the families.
And if you get someone in for rehab, whether it's a hip replacement or knee or shoulder or anything, even if they've had a stroke, that's really when you know what's going on with these people, isn't it?
Right. And it helps if the patient's, alert and oriented. A lot of times, post-operatively, they're confused from the anesthesia, and they slowly come to. That's a tremendous help when that happens. But it's the ones with more of the catastrophic situations, like a stroke, maybe a multiple trauma from a motor vehicle accident, things like that. Those are the head injury, spinal cord injury. Those are the real tough ones, because you really can't, a hip or a knee. Okay, we're going to give you the rehab. You're going to go home. You'll be fine. But you can't just say that with the catastrophic situations. You really have to play it by ear and see how they're doing.
Well, I see that you all are going through so much expense with renovations, changing this, you're having small refrigerators, and you're having, changing the floors, and you're really, and of course you have this mini apartment, which I saw years and years ago at the Miami Jewish Home for the Aged. Mm-hmm. They had a very special, must have been 25, 30 years ago, that they had everything that was unique that none of us even could have imagined they needed. And they were testing, they would have people go in there and sit down, try to cook something, and they would televise it and watch what movements they had, and then they would know what size, how low the counter should be, and it was quite a science that they did. But now I see that you feel that it's worth having almost a little apartment, so that people, if they've had shoulder injury injury, that they actually need that.
Well, they do, and to get them back to independence, especially if they live alone, or they were the caregiver for their spouse, you need to get them as independent as possible. It also really helps with the fear factor that most patients suffer before they go home. They're afraid.
Are they?
Even if they really want to go home, but there's that fear that they're going to screw something up, So, you need to know if they can cook themselves a nice, easy meal. Otherwise, you have to start looking at getting meals brought in. There's a lot behind it besides just, it's a nice marketing thing. You have to know what they're able to do. Can they get in and out of a regular bed? They might be able to get in and out of the hospital-type beds that we have, but when they go home, they're not going to have that kind of bed.
It's too high or something too low.
It's lower or whatever, a regular bed. So we need to make sure they're going to be able to get in and out of the bed. Simple things, in your bathroom, where do you keep, certain things? Can they get to the lowest drawer and get things out, or do they need to move things around?
It's interesting you talk like that, because my husband has macular degeneration in one of his eyes. And he'll ask me where something is, and I'll say, oh, it's right over there, and he can't see it. It is there, and he can't see it. So it's lucky that he has me, and for many reasons, but really just talking as a consumer and a healthcare provider, that I can see how hard it would be for someone who's very bright, he can handle a lot of things, but if he can't see well, he's going to be in deep trouble.
Right.
So now what are you going to do about that? You can't change the macular degeneration. What are you going to do?
You have to look and see, should things be arranged differently for him? That make it easier for him to find things. He's got it in one eye, so the other eye you still have regular vision. So he's going to have to learn to compensate. And, there's places that you probably should change where things are so he can get to them.
Oh, we've changed it. We've brought in more lighting. We have flashlights. Yep. We've done a lot, but it's still, it's not perfect.
Right.
And the other person there, when he can't see the remote, even though you put it in a certain place, and of course people, they move things.
Right.
So I think that, so let's say someone's staying at Regents Park of Boca in the nursing area. Who can they rely on in that area, even though, because someone can't be with them 24 hours a day every moment?
No. If it's short-term rehab, you have to understand they've got macular degeneration. They might be legally blind. There are a lot of different, you can't fix that, but you have to help them learn how to compensate. They always have to have that nursing call bell, regardless if they're there for long-term or short-term care, where they can feel for it and get it, and call the nurses, or, the aide can come in to help them with whatever. So much of rehab is learning how to compensate. If you can no longer, move your left side, you need to learn how to compensate, If you're right-handed and you lost your right side, you have to learn how to write with your left hand. Probably eat with your left hand. So there's a lot of things compensatory techniques that you teach people if they've lost the use of any part of their bodies. And it's the same with vision. You know, just like people that are blind, they get around.
Oh, they
because
do.
They've been taught, you know.
I have to tell you, just you mentioned that, but the CEO, I've had her on the radio show of the Miami Lighthouse for the Blind, did have her vision, and then she lost it, and she knew she was losing it. And she runs that whole organization. She's blind. She has a seeing eye dog. She has a husband, but she runs it. And she gets up. She's at sometimes 5 o'clock on my show, and she's amazing.
Yeah.
And so I do understand what you're saying. There's a lot of compensation. But so in what you're doing here with adding a new room, you know, I mean, a mini house, a little mini, what do we call it, mini cave?
Yeah.
That will help with a lot of things, and I can see why that would be good. And your organization, which has just been a wonderful organization, the way that they have, first of all, the site that they bought many years ago, the way they designed it in it is like it's almost like a campus, a beautiful campus that you would go to.
Oh, it's beautiful.
Mm-hmm.
You know,
with the views of the water and the gardens.
Yeah, you look out of any of the rooms, and they're nice views. And there's so many trees around. It just really is pleasant.
So now you all decided that you're going to spend a lot of money. It's not a little, lot of money inside to make it like the Ritz.
Right.
Again, it always has been like the Ritz.
It has been. It's just, you know, upgrading the rooms for our long-term residents. Mm-hmm. Again, it's their home, you know, and, you know, it's like I need to paint the inside of my house right now. So
Don't we all? In fact, I have this little new dog you've seen, Snowy, I think, and she loves to walk. As she's walking, she loves to just put her head against the wall. Well, sure enough, now I'm seeing this little, you know, it's not quite black, but it's a little darker. And I keep saying, no, Snowy, don't do that. I don't know if she likes to scratch herself or something. But you're right. Everybody needs something. But this is, of course, like a hotel. You have to keep a hotel first class.
You have to keep it up. And, you know, we have a lot of wheelchairs and walkers, and they bang into doors, and they bang into the walls. So it's going to be constant, you know, because the walls are colored. They're different colors. And they really look nice. But we have a full-time painter just to maintain
my goodness,
where things get
about that.
Beat up.
Right. And so how about the food? Let me just do this again. I want to get everybody to have that phone number. Get this phone number, put it up on your refrigerator, because it's not that you may need it today or you may not need it tomorrow, but you may need it in 30 days from now, maybe for a friend. Make sure that you tell them to call the Regents Park of Boca Raton, and the phone number is 561-483-9282. 483-9282, and go on the web, which is regentsparkboca.com. You'll be amazed because they have their own YouTube channel, and that's youtube.com/Regents Park Boca. And I know that Laura Belgrave's responsible for that. She is this woman who just never stops, and you're so lucky to have her for you as your sister. I must tell you, your sister, and she is such a delight. But just, you know, going back to this, that I think someone has to go for a tour ahead of time. As I said, you don't know what something is.
You know, I preach this all the time. You know, you'll meet people at the Boomer EXPO or wherever. I don't need rehab.
Yeah, Regents Park Boca. Go see them at the Boomer EXPO. Thank you.
I don't need rehab. Well, you may not need it today, but at some point you will, because when you end up in the hospital, honey, 3 days if you're lucky. You know, they're going to move you out faster than you could imagine, and they'll give you a list of nursing facilities, nursing and rehab here. Well,
right.
They don't have a clue. Now they're touring. The kids from, you know, upstate New York are trying to tour all these facilities. They don't know which is good, which is not. So I strongly recommend, you know who your physician is. You know which hospital you would go to for anything elective, or given the option, you know where you would go. You better know which rehab center you want to go to, because the day of discharge, they'll say, here's the list. got to go to a nursing facility. You need rehab.
Yeah, and even expanding on that, there are certain doctors and certain social workers that have preferences, and they will tell you where they think you should go. And so that maybe they have an allegiance, maybe they really believe it. But I have had a few instances recently in my life where somebody said they were going to go to a certain place, and I recommended Regents Park. Oh, no, my doctor, he's in charge here. And they went, and after 2 weeks, they were crazy. They said, how could I have come here? I said, well, I tried to tell you, but you said your doctor was going to take care of you. Right, your doctor's not going to be there taking care of you. So it's very important that you said, Leslie, go see what they are. It's a good education anyway.
Right. And, most primary care physicians do not follow their patients at the nursing facilities. So you're going to get a doctor who goes there routinely anyway. That's just the reality. There's a lot of doctors that refer to us, the primary doctors, and they have somebody that follows their patients while they're there. And that's with any facility. So unless your primary doctor is going to follow you personally,
which they don't have the time to do, unless it's your son or your brother-in-law or your somebody or your daughter. We know daughters are doctors. Sorry, I didn't mean to use that. But that's really true, and that's why I know you have a lot of events there. And I don't want to forget that for people who want to go to certain support groups, that you do have some really good things. I'll just tell you, they have a pet therapy dog training. Yeah, that's really good for dogs. You need to have that. They have actually Codependency Anonymous 12-step program, and that's not just for drinking. Is that for smoking too?
Codependency is for whatever reason you're codependent. Yeah.
And then you have odor eaters. I was going to say Overeaters Anonymous. And you have a lot of programs there. It's good because people then feel comfortable going there, and then they meet friends. And
right.
Well, I'm really happy that you came to the studio, Leslie, because I do love so much what you've done at Regents Park. It is just a beautiful, beautiful campus. I don't want to call it a facility. I don't want to call it anything like that. It's like a healthy living campus. How about that?
I like that.
Okay, we'll do that. All right, thanks a lot, and we'll see you at the Boomer EXPO.
All right, thank you so much.